Hi students, I welcome you all to Obstetrics and Gynecology with Mackler. So in this module, we are going to deal about the reports of colposcopy, right? So based on the reports of colposcopy, what treatment options can be done in patients. So this is all about which we will discuss in this module. So as we all know, colposcopy is a diagnostic test. Since it is a diagnostic test, based on the reports of colposcopy, treatment can be done. Yes, so while doing colposcopy in any patient, colposcope is actually a magnifying instrument. With the help of this colposcope, you're going to take biopsy from any abnormally looking cervix and abnormal blood vessels of the cervix. So once you're going to take biopsy, you're going to subject it for histopathological examination. So once you send it for histopathological examination, the reports of colposcopy can be of three kinds. One is that it can be cervical intraepithelial neoplasia type 1, cervical intraepithelial neoplasia type 2, and cervical intraepithelial neoplasia type 3. Now, while discussing about the cervical intraepithelial neoplasia type 1, it corresponds to low-grade squamous intraepithelial lesion report of pap smear, or the HPV-induced changes that happens in the squamous cells. So human papilloma virus, which is the most common cause of cancer cervix, right? So human papilloma virus induced changes in the squamous cells of the cervix, or it corresponds to the low-grade squamous intraepithelial lesion report of the pap smear. So CIN1 corresponds to LSIL, whereas the CIN2 and 3 corresponds to high-grade squamous intraepithelial lesion report of the pap smear. Is that clear? CIN1 corresponds to LSIL, CIN2 and 3 corresponds to HSIL. Okay, so what is CIN1, 2 and 3 as we discussed in the previous module? CIN1 means the dysplasia has limited to less than 1/3 of the cervical thickness. CIN2 means the dysplasia is involved 1/3 to 2/3 of the thickness of the cervix. CIN3 corresponds to the dysplasia has involved more than 2/3 of the entire cervical thickness. So, out of these three things, CIN1 corresponds to dysplasia limited to less than 1/3 of the cervical thickness. So, since it is involving less than 1/3 of the cervical thickness, there are high chances that this cervical intraepithelial neoplasia will get spontaneously regressed in the next 2 years. If it is going to be regressed in the next 2 years, then it is well and good. You can just resume the process of screening for cancer cervix in that patient till the set years in the guidelines. But if in the next 2 years there is no spontaneous regression of cervical intraepithelial neoplasia type 1, you have to take some vigilant action, because it is high time you have to take any vigilant action. If at all you're not going to take any specific action, there are high chances that this dysplasia, which is initially involving less than 1/3 of the cervical thickness, will progress and eventually involve 1/3 to 2/3 or even more than 2/3 of the cervical thickness. So for that reason, you have to take some treatment options. And the treatment options which are available to us are cryoablation. So cryoablation is nothing but you are going to use the technique of freezing, and with this freezing technique, you're going to destroy the abnormally looking cervical tissues. So, in order to do this cryoablation, which is a minimally invasive procedure, there are certain criteria which needs to be fulfilled. The details about this cryoablation will be discussed in the next subsequent module, but as of now, you have to understand that if it is not getting spontaneously regressed in the next 2 years, or if it is going to be persistent beyond 2 years, then you have to do the treatment, and the treatment options cryoablation. And there are certain criteria for this cryoablation. If the criteria are fulfilled, you can perform cryoablation in that patient. Right? Yes. But if at all the criteria is not fulfilled, you have to do excisional procedures. Only if the criteria is fulfilled, you can do cryoablation in that patient. If the criteria is not fulfilled, you have to do some excisional procedure. And what are these excisional procedures? Those are LLETZ and LEAP. So LEAP stands for Loop Electrosurgical Excisional Procedure. With the help of electricity, you're going to perform an excisional procedure that you're going to excise the abnormally looking cervical tissue. Is that clear? Yes. So there are certain criteria for cryoablation. If those criteria are met, you do cryoablation. If the criteria are not met, you have to do some excisional procedures such as loop or LLETZ. So this is all about the CIN1. So now while discussing about the CIN2 and 3, what are the treatment options? So while discussing about CIN1, the treatment of choice was cryoablation. If the criteria was not fulfilled, then you go for some excisional procedure such as loop electrosurgical excisional procedure. But when discussing about the CIN2 and 3, well, whenever someone asks you what is the treatment of choice for CIN2 and 3, so the treatment of choice is going to be LEEP or LLETZ, loop electrosurgical excisional procedure, or LLETZ. Right? So this is the treatment of choice for CIN2 and 3. But you can also perform cryoablation in this patient if the criteria for cryoablation are fulfilled. And excisional procedures which are available to us are loop electrosurgical excisional procedure, and the other procedure which also can be done in patients with CIN2 and 3 are conization or cone biopsy, where you're going to remove a cone-shaped wedge tissue from the cervix, which is going to involve the ecto, endo, cervix and the transformation zone. So this is all about the algorithm which is available to us. So based on the reports of colposcopy, the treatment will be decided. CIN1, the treatment is going to be cryoablation. Criteria is fulfilled, you can done. If the criteria is not fulfilled for cryoablation, do some excisional procedures such as LLETZ or LEEP. For CIN2 and 3, treatment of choice is loop electrosurgical excisional procedure or LLETZ, or else you can also perform conization, or if the criteria are fulfilled for cryoablation, you can do this cryoablation as well. Is that clear? Okay. So as of now, we have discussed about the treatment options for CIN, cervical intraepithelial neoplasia. So in the subsequent module, we'll be discussing about what is cryoablation and what is the principle of this procedure, and we will also discuss about this LEEP or LLETZ. Is that clear? Okay. Regarding conization, we have discussed about conization in the previous module itself. Okay, so let's meet in the next